All right, we're recording, and we're sitting here with Senator Missy Irvin from Mountain View. I've worked with Senator Irvin for a long time, and I'm glad that she came on today to visit with us. She's run a pretty important bill for the business community, which is Senate Bill 410, the ARHOME legislation, which has typically been known as other things as private option, Arkansas Works in the past. So it's over on the House side today with her colleague, Michelle Gray, running it in the committee. Just tell us a little bit about that and
Sure.
nuts and bolts of that, because it is an issue that has been back and forth all over the place over the years. So I think you've got it in a good place now.
Yes, I think so. And I appreciate that. I think for a lot of us, what ARHOME does is it's really an acronym for Arkansas Health and Opportunities for Me. And so I want to always refer back to that title because it's very important, that describes the program. So the program really it's a healthcare program, but it's also about the opportunities that currently exist for individuals, both at the federal, state level, and community level, and being able to connect all of those to an individual to really help them improve their life circumstances as well as their health outcomes. And it's for me. So it's individualized and it's tailored to meet the needs of that person and that individual. So what ARHOME does is the financial policy is the same as we have put in place 7 years ago under the private option. So really that was a first step in trying to see if this was going to work or not. And what I mean by that is we are partnering with your private insurance companies in order to create a premium assistance program. That has proven to actually be the most financial conservative approach that we could possibly take. And we have 7 years of data to prove that. And so what that financial policy has done for the state of Arkansas has been to allow us to draw down a greater amount of federal revenue into the economy of the state of Arkansas, and particularly our healthcare infrastructure. So it has proven to work in that capacity. It's actually also proven to keep and reduce the growth rate of the Medicaid program. Why? Because we apply for what is called a Section 1113 waiver. That is a section within the Affordable Care Act that allows states to do their own programs and their own demonstration waivers. So basically to create our own thing outside of what is dictated within that legislation. The beauty of a Section 1115 waiver is that it requires budget neutrality, which means that we have to be budget neutral, which means that we negotiate a set rate and we have to stay inside of that range. And that helps us control the growth of any spending in that Medicaid program. When I came in, our current trend was like 7.2% growth rate annually in Medicaid spending under the traditional program, which was unsustainable. It was depleting our Medicaid trust fund completely. It was requiring a huge chunk, 50 to 60% of any surplus that we had to basically plug a hole. And so what this program has done financially has stabilized that growth rate down to a 4.2%. And that's more sustainable. And it also allows for us to utilize state general revenue more effectively because we're leveraging it to get the federal dollars back into our state. And that helps stabilize our healthcare infrastructure. In fact, there have been 57 rural hospitals closed in the surrounding states of Arkansas, and only one has closed in the state of Arkansas. So we have kept our rural healthcare infrastructure intact and in place because of the passage of the private option. When Arkansas Works came about, you had a lot of folks that said, listen, we want to make sure that beneficiaries are, have some personal accountability and responsibility in this, but we also want to get them on a path of improving their life circumstances and trying to help them improve their work situations. And I think that's a great thing to do, but I think that's important. We want to make sure that people have the skills that they need to find a good job or to improve their jobs. So that was the attempt to do that. The problem, though, is that it's not a one size fits all approach, because you have the ability to look at who are actually the beneficiaries on this program. And you have, young people that are in college. You have people that are working, but need to try to get to a better position and get to a better job. That's great. We can go in and wrap around those people and help them do that. But you also have veterans who have some major issues. There are close to 15,000 veterans currently on the Arkansas Works program. Well, they have special needs that need to be met. And so the Arkansas Home model creates 3 different ARHOMEs. One is maternal, which is targeted and intentionally designed to address the needs of our expecting mothers. And that's really critically important, because we want to make sure that those moms are accessing healthcare in that first trimester. Because if they do that, we're going to have healthier babies born. And currently, you had, I believe, 2,100 babies that required a stay in the neonatal intensive care unit. And that, combined with all the other prenatal and neonatal issues and complications and high-risk pregnancies and low birth rates, that annually costs our Medicaid program about $100 million. And so if we can affect that early on and work with those expecting mothers to make sure that they're getting good health care, that's going to really help not only save the state money, but it's also the right thing to do to help that baby have the best chance of entering this world without complicated health problems. So that's the maternal ARHOME. The second one is the success ARHOME, which I talked about. The veterans, they are in that piece. They need mental health resources because a lot of them are dealing with issues that are really critical as it comes to what they've experienced and gone through. They also have perhaps more disabilities and different types of needs. And so the success ARHOME is really targeted to veterans, those that were formerly incarcerated in DYS. Those are youth and young people that need extra help to get them back into life and transition, I think, into the world of health insurance and work and all of those things. But they need some special, attention as well as children that were formerly in foster care. So the success ARHOME is targeted to those populations. And then the third ARHOME is the rural ARHOME, because in rural Arkansas, we know that mortality rates are higher, as well as morbidity rates, which means people that have more than one illnesses that complicate their healthcare issues. And so those rural ARHOMEs are designed to intentionally meet the needs and improve the health outcomes of rural Arkansas. And all of these require partnerships with voluntary anchor hospitals. So these hospitals will get an additional level of funding if they participate in the program to help them be partners with us in really creating these ARHOMEs to meet the needs of these targeted populations to improve their life circumstances and improve their health outcomes.
Thank you.
I know that's a lot, but
yeah.
I mean,
No,
I just, it's a lot. And but it's so cool to be able to intentionally design a program around the needs of the people that are actually on the program.
Yeah.
And it is an aggressive approach, no doubt. It's going to require a lot of work. It's going to require, huge participation in all across the state of Arkansas with the different anchor hospitals. And I know that I look forward to, really working hard on the implementation piece of this, but it's the right thing to do. And I know that there's some people that will say, well, is this going to work? Well, yeah, it actually has worked in other states. And we've done a tremendous amount of research looking at what has been effective? What are those best practices that we can employ and integrate into this program? And so, I feel confident that CMS is going to approve this. They are very interested in, I think, those different types of determinants that are causing probably some of our health outcomes. And so how we can address those. And I think that's really going to be a huge win for the state of Arkansas and for the people that are the recipients of this.
Yeah, I have a family member that is a recipient of Arkansas Works with mental health issues. And I can tell you from experience in dealing with those in the last year or so that she was living in Florida, and I brought her to Arkansas so I could keep a better eye on her and help her, and enrolled her in Arkansas Works. The difference between the Florida system and the Arkansas system is night and day when it comes to health issues. That is for sure. So she's getting excellent care at UAMS and because of the Arkansas Works. So I appreciate.
So you can imagine, I mean, I think with what you just told me, you can imagine where our veterans are, right? I mean, you have 15,000 veterans that are currently on this program. Who in their right mind would want to kick veterans off of a healthcare program?
Yeah,
I'm not. And I will just finally add, and I'm so glad that you brought that up, because it's not just veterans that have those issues. I mean, you do have young mothers and that are expecting. You have those issues. You have kids that were in DYS, Division of Youth Services, that perhaps were at one of our centers. We want to make sure that they do not go into the prison system. Well, how do you do that? Well, you say, okay, we've got all of these programs that are available to you already through state government. We're just going to kind of create the vehicle to put them all in the vehicle and bring it to you. And that's what ARHOME is designed to do. It's to put everything in the vehicle and bring it to the person. And so it's intentionally designed around them. We also have, I think, around 17,000 former incarcerated that are on the program. And so again, we want to make sure they don't go back to prison. Recidivism is an issue. It does cost the state of Arkansas a ton of money. Wouldn't we rather help those individuals transition and get out of that, cycle so they don't end up back in prison? Well, let's help them. Let's figure out a way to help them. And then I also want to mention this as part of the success ARHOMEs and the rural ARHOMEs is we are actually going to utilize these rural hospitals as crisis stabilization units. Just like we have built around the state of Arkansas, we know that we need crisis stabilization units in order to help alleviate what's happening in our jail systems and in our emergency rooms. And that we need a place where somebody with severe mental issues can go and not have to go to jail or go sit in an emergency room. So, and we already have a healthcare infrastructure in place. We have empty beds and we can utilize those beds to meet our needs. And that's another design of ARHOME, which is an added layer, which I think you find a huge support in the legislature for, because we understand those issues, at a local level, as well as how it affects our entire state and those individuals. So that is a whole nother piece of this, which again gives an additional revenue stream to our rural healthcare infrastructure, which is desperately needed. And if I could say one final thing, COVID really, when it hit, it was surprising and shocking that you had so many hospitals and people in healthcare that were laid off. When we were laying off nurses, lab technicians, we were laying off all personnel within hospitals and clinics, doctors were laid off. And these are the exact people that we needed in order to get us through the pandemic. And so it really shows how, even with what we have done, how razor thin our margins are at a lot of our hospitals. And so, ARHOME is critically important. It will generate and bring in $10 billion into the economy of the state of Arkansas. I cannot emphasize that enough. This is a $10 billion bill. And the consequences of not doing it, or the consequences of doing it a different way, are tremendous to the economy of the state of Arkansas. We cannot afford to do that. Our rural economies depend on that cornerstone piece of healthcare in their local communities. Because if that goes away, if those rural hospitals close, you're taking with that a ton of jobs. You're taking away the ability to do any meaningful economic development. And so this program is critical for the state of Arkansas.
Yes, it is. Not only budget wise, but as you mentioned, economic development wise, it helps in so many areas and helps so many people as well from all walks of life. From my family member who is a single mom and dealing with mental health issues, and to people that are, like you said, coming out of prison or just need a little help right now. And so I appreciate your efforts on that. And it sailed through the Senate, which Arkansas Works and Private Option usually they didn't sail too well. It's always kind of a pull to get those through. But
well, can I just also mention that, we did not have access to claims data until about a year ago. That was a problem. But now that we do have access to claims data, we can actually see if it's working or not. And we can see how it's being utilized, which is why we know that I think it was, almost 60% of the women that were expecting babies were not seeking health care in their first trimester. That's a problem. I mean, Arkansas is 49th in maternal and infant mortality outcomes or health outcomes. We're 49th. I mean, that's pitiful. We've got to do better. And so we can pull that claims data to actually see if that's working. We also, let me just also say, accountability wise, we need to track this, and we have that built into the bill that the legislature is tracking to see if it's working or not. I don't want to just pay premiums monthly for a program that's not working. That's not effective use of taxpayer dollars. And so it's important for us to build in financial penalties and to require that the insurance companies who we are partnering with are also helping us improve those health outcomes, and that we're measuring those goals and defining those goals, and that we do have financial penalties put in place if those goals are not met. So if we are going to pay for an insurance product, we want to make sure it's working, and we want to make sure it's improving the circumstances of those individuals. And so that's another huge component of this bill, but I think it's one that's critically important because we want to know if it works or not. Why spend money on something if it's not working in the arena of health outcomes? And for a lot of people in the legislature and in the state, that's really, really important. For a lot of people, the financial outcome is all they need. And they say, listen, even if that's not, working, the financial piece is working, and it clearly is. But for me, I think it needs both. I think you need to make sure the financial component policy is working, which we know it has been, we know it is. But I also think that the health outcomes and our goals need to be defined. They need to be able to be measured, and we need to continue to make improvements because Arkansas does not need to be 49th in maternal and infant health outcomes. I think we would all agree on that point. So let's work to address it. So that's what we're trying to do.
All right. Well, thank you for everything you're doing on that. I also wanted to mention one other thing. You are also chairman of the Education Committee in the Senate. And my colleague, Giovanni Sarmiento, was in there yesterday. I joke with him because Megan Godfrey had a bill before y'all yesterday, but in the House, when it was in the committee last week, she brought him in to testify, and then it went right out of committee with no problem. So I started calling him the ringer. And then yesterday he testified to your committee on the bill, and same outcome. So thank you for giving Giovanni a chance to talk about it a little bit, and even gave him a little bit of a big head, having him testify in Spanish as well. So I told him he was just kind of showing off now. So, but
well,
but,
I thought it was appropriate. I mean, we were talking about bilingual immersion, and I think that's really important. I have family members that are from Argentina and Colombia. These were exchange students that stayed with us. And so I have a Colombian child who graduated from UCA. And I also have a brother in Argentina, Mendoza, Argentina. So, you know, I think it's just really critical, and it's important for us to be able to speak in multiple languages, and for us to be able to embrace that is important. So it was fun to have him before the committee. I hope I didn't embarrass him, but I felt like it was very appropriate that he deliver his comments in both languages.
yeah, well, it's spring break. He had his daughters with him, so they could
Oh,
see the Capitol. So
that's so fun.
yeah, and
My poor children, I had to drag them up here for spring break one year. And it ended up, they came from the swimming pool. My daughter, Alan, she was in the swimming pool, and they just had on shorts and t-shirts and swimsuits underneath. And they came up to the Capitol, and all of a sudden she's sitting at the end of a table in a committee room testifying for a bill. I could not believe it. She raised her hand and she's like, I want to say something about that. And I was like, oh Lord, okay. And so I'm just, I couldn't believe it, but I was so proud, of course, as a mama. I was so proud that my daughter, who was like, hey, I'm in like gym shorts and a t-shirt, but this bill affects me because I'm a high school student. And so I got something to say about it. And she sat down and testified for a bill. I was amazed. So
well,
I was really proud of her.
Well, you're raising her right and you're training her well.
Yeah, thanks.
Well, thank you, Senator. I've always enjoyed working with you, and I appreciate the work you're doing on our home. And hopefully, it will just go right through the House like it did through the Senate. And because I know Michelle's very competent in handling it on that end. And but we appreciate you sitting down with us, and wish you the best of luck through the rest of the session. Hopefully the end of it will be here before you know it. So.
Oh, I know. Thank you. I appreciate it. Please reach out to me. I will just give my cell phone number to your community. It's 870-740-9694. You feel free to text me or reach out to me at any time you need to. So I do appreciate that very much.
Yeah, we do too. I could testify to that. You do answer your phone and you do respond to text. So.
And I do text you like late at night.
That's right. Well, thank you,
Thanks,
Senator.
John.
And you have a good day, and
You
enjoy
too.
your spring break. I guess after today, y'all are taking a couple of days off to go and do spring break. And I'm taking my son camping to Devil's Den after lunch today. So.
Oh, fun. That's great. Well.
Yeah.
That's wonderful. I'm heading actually to Missouri and Oklahoma State. My daughter has been accepted to veterinarian schools. So we're on this grand tour. I was in Baton Rouge last weekend. So
yeah.
Exciting.
Well,
anyway,
all right. Well,
thank you.
Thank you, Senator, and have a good day. And thank you.
Okay, you too. Bye.
All right. Bye. Let me figure out. Hold on.